let's introduce ourselves.
Yeah.
We didn't have a practice.
No.
But, so. My name is Dawn Hancock. I am the owner, founder of Pivotal Birth LLC, and I am based out of California. I am a skilled labor and delivery nurse who stepped away from the bedside to full-time educate families, both on TikTok and in my own business. So I love advocating for families. I feel like I get to reach a lot more people and help empower you to make choices in your birth, postpartum, breastfeeding journey. So again, I'm Dawn. Do you want me to tell them about you?
Sarah's lost her voice.
I lost my voice. But I'm
Turn that mic up.
Yes. Maybe I can't talk.
This is Sarah. She is a high-risk labor and delivery nurse. She is very prevalent on TikTok. You can find her. She's a labor junkie RN. She's incredible. She's also a mom and just does all the things. So this is Sarah. Yeah. I'm Tina. So I am Mama Nurse Tina on TikTok and Instagram and Facebook and YouTube. And I think all of us have the common goal that we just feel like there could be more to it for every person that's giving birth. And there's a lot of sort of things that might be missing from people's birthing experience that maybe they didn't know that they could have, or maybe they wanted to have but felt like they couldn't. And so I think a lot of us have a platform because if you're working with one-on-one people, it's incredible, but it's one birth at a time. And if you're on a global platform, it's like we can really kind of change the meter on where things sit in the birthing community. So you can find me there, and I'm a mom of 4, so if you have any questions about having too many kids, that's would be a good one.
Hi everyone, my name is Sydney. I'm a labor and delivery nurse. I graduated in 2020, so I'm about 4 years under my belt. I'm a fresh L&D nurse, but I absolutely love it, and I will be in labor and delivery for the rest of my career. It is where I'm meant to be, and yeah, you can find me on TikTok, Instagram, YouTube, Facebook as well. Facebook, nurse_Sydney. That's where I post all the stuff, and yeah, I'm excited.
I'm Kara. I'm Kara, the baby nurse on all the platforms. I'm a mom of 3. I have a 5-year-old, 3-year-old, and a 1-year-old. So if you have any questions about having kids too close together, then I'm the person to talk to. I'm just kidding. I love it. But I work in postpartum and in low-risk NICU, so I was telling Tina last night, I don't like babies when they're inside you. I mean, I do, but they scare me. Once they come out, great, we're Gucci. So I'm all the things postpartum. So, yeah.
Any questions?
From the audience here.
Yeah, let's start with the audience.
No one be shy.
Come on, guys. There's so many questions.
Come on.
Come on.
And ask us
What?
questions.
From the live is who is present in the birth room?
Oh, yeah, it depends on where you.
Depends on where you give birth. So there's different birth settings. There's going to be home birth, there's going to be birth center, there's going to be a hospital birth. It could be a smaller hospital, it could be a higher risk hospital. So I think it depends on your birth, what you would like for your birth, and what personalities you would like to have there, but also your specific situation. So if you have a baby who they're concerned about, or you have a condition that they're concerned about, then there's going to be more people at the birthday party versus not as more people. So I'll speak for myself. I work in a hospital. So for me, if it's just kind of a low risk labor happening and things are looking great, then it would be your primary nurse, and then it would be your obstetrician or your midwife or your GP, and then there is usually one more nurse that comes in to take care of your baby. So your baby gets their own nurse like right off the get-go because they're super special.
3 staff.
Yeah.
So in a low risk setting, maybe 3 staff members.
Mm-hmm. Yeah.
Is it ASMR?
Yeah.
3 staff members. I'm seriously gonna have to whisper. Yes, but it depends on the policy. You might be able to bring 3 visitors as well.
Yes, visitors chair.
I'd like to, and then of course it depends on your situation. So there could always be a respiratory therapist who might have to come if the baby has passed meconium, or maybe they needed vacuum assistance. Sometimes the pediatrician will even come, or neonatal nurse practitioner. So In high risk, do you guys sometimes have neonatologists present with those births as well? So, we always want like a cut and dry answer, right or wrong, black or white, simple, right? And there's really not much in pregnancy, birth, or breastfeeding that's simple. So it varies on your situation.
As a first-time mom, IVF mom, should I schedule a C-section, induce? Why do they push inducing?
Oh my, that's a little loaded. Okay. Who wants to roll? Yeah.
Do you want to start?
Sure, yeah.
You should do what you think is best for your body and your pregnancy. However, you should have a provider that you trust, that you have a really good rapport with, that you align with, and you can discuss the options that are available to you. There's not one option for everybody, right? And there can be options that they're going to suggest that you may not agree with. So jumping to a C-section, hey, if it's good for you, then it's good for us. But if it's not what you want, then there's no reason you have to jump to it. And if there is a reason that they say you should jump to it, you can ask them the whys and the what ifs and the what else is there for options.
Yes, that's beautiful.
Yeah, no, you said it perfectly. It's exactly what you want to do. There's not a one size fits all. If you're like, yeah, I actually want an elective C-section, talk to your provider about it. That's okay. You can totally do that. I think that they also asked, why did they push inductions? And, sometimes this is recommended for patients who have had IVF. There's many reasons, but again, I would say talk to your provider because there could be specific reasons to you. Like, what if the baby's breech and they don't do breech vaginal deliveries? So this is an option for you. Does anyone else want to talk about IVF and inductions? Do you have more information about this?
I do want to say one thing about that, if it's okay. So my recommendation, I'm sure a lot of you here have heard the BRAIN acronym. And it doesn't matter if you're IVF, if you're advanced maternal age, it doesn't matter if you are dealing with gestational diabetes. Think of the BRAIN acronym, okay? So B stands for benefits. Understand what are the benefits of me go ahead and having an induction now because of my IVF. What are the risks? There are no risk-free options. So make sure you know the risks that come with having an elective surgery, like a primary cesarean that's not medically indicated yet. Next, the A stands for alternative. What are my other choices? It's not just yes or no. What are some other choices that I might have here? Like, if you're not really feeling that you want to be induced, you can ask them for NSTs, which is a non-stress test, to keep monitoring you and the baby and making sure things are good for you. And then I stands for I. What do I want? What does my intuition say? Because you are making the choice. Remember, there are no risk-free choices. None. So you are the one that has the scale. Which risks am I willing to take? And you get to ultimately be the one who decides. And then N stands for no, or I need some time, or maybe even not yet. Not yet is a good one too, because you always have the right to change your mind also. You are not, you don't say I don't want an induction and then you can't get one later. If you change your mind, if something shifts, then you get to shift as well, all right? You always have the prerogative to change your mind.
Yeah, I wanted to know if there were any tips or tricks or anything that can be done in preparation for like one's first VBAC.
Look at us all.
This is wonderful. I'll just do one point and then everybody can share. But I think my first recommendation when we're talking about VBACs is oftentimes providers can say things in a way that makes us believe that risks are higher than they are necessarily. So instead of saying something along the lines of, oh my gosh, the risk is high of you having a uterine rupture. But when you actually look at the numbers of the risk of uterine rupture with a vaginal delivery, with somebody who's never even given birth before, and you start looking at all those numbers, what does the number say for somebody who actually goes in and has a C-section, just does a repeat, because they also have uterine ruptures, and then what are the actual numbers? So when you ask them, you want to actually know what is your absolute risk, not the relative risk, okay? So please learn about the risks. That would be my first thing, and of course comfort measures and so much more, but I'll just pass along here. There's so many things.
I would look into, I always ask people like, should I have a C-section or should I have a VBAC? For me, like look inwards and be like, what was the reason that I had a C-section? Like,
Great.
was the reason I had a C-section a fit problem? Was there an issue that baby couldn't engage, that baby could not get down into that pelvis? Or was it an issue with like, baby had some fetal heart rate issues and that isn't typically going to repeat itself in further pregnancies, like that's not going to affect it, right? Whereas a fit problem, you have to think like, oh, that could repeat itself, but again, that's dependent on so many factors as well, right? Second baby, the size of the baby that you have versus the size of the other baby, you know what I mean? The type of labor pattern that you're in. So, yeah, right? So I always think, like, look at the information as a whole before you just decide, I had a C-section, so I need another one. Why did you have the C-section? Like, yeah.
Can I add a tangent to that, or
Yeah,
related
yeah, please
to
do.
the question? For me personally,
Yeah.
it was premature labor.
Okay.
So I don't know if that changes anything.
But like premature, this is personal, premature labor and like baby had heart rate troubles, or premature labor just because baby
It
was.
was more of a, I was 21, 27, 6, went
Okay.
into labor with twins.
Oh,
They
yeah,
were
yeah.
like, get the C-section, and I did.
Okay, yeah, right? And that's the other thing, right? Is that you may not have been presented with all the information. Like, could those twins was baby A head down, and could those twins have come out vaginally, you know? But like, we just jumped to it because there's a few things going on. There's twins going on. There's preterm labor going on, you know what I mean? And so you have to sort of look at it as a whole. But I like say, like, information's gonna be your best friend, especially in a VBAC, because people will say to you, there's a big risk of uterine rupture. It's like, but it is there? Like, sure, I want to know that you need to know that there is a risk of uterine rupture because of a previous C-section, but like, why did we have a C-section? You know what I mean? And then take that information into all the other things that they're going to tell you and make a really informed choice.
And in your particular situation, like, think about, do you want a VBAC? Like, is that something you're interested in doing? It's because you're asking the question, I'm assuming that you are, which is amazing. If that's something you want to explore, and it sounds like you did have your C-section a number of years ago. I don't know how long you said, but
Almost 6 years.
6 years, yeah, because that's another thing is timeline for C-sections. So you can't, or VBACs, I should say. If you've had a C-section really recently, or if you've had more than one C-section, that's another big factor. So most providers will not recommend a VBAC if you've had more than one uterine surgery. Okay, so that's a really important thing to keep in mind as well.
Even
It's
though
possible.
ACOG
Yeah.
recommends differently.
It's
Okay,
Yeah,
okay.
but
It's
it's
a majority of providers.
provider dependent.
Yeah.
Yeah.
Yeah. So,
So
I mean,
get the
it's out there, and maybe
get
you
the
can find a
info.
provider who will do it.
Yeah. Get the info.
But, yeah.
And then?
I'll take the next one. I know, y'all said everything I want to say.
And the first one, what are the top 3 mistakes that the spouse do during the labor?
I do on this one.
You repeat the question to the people online.
Yes.
And the other question is to you, Kara. What do you expect them to check all the time till the first checkup with the doctor?
Okay, so the first question asked was, what are like the top 3 dumbest things that like a support person has done?
Yeah.
There's like so many. It's like, I can't even, but I would say, honestly, the thing that irks me the most is just people that are like really not helping when the mom or whoever gave birth is like obviously struggling. So if you are like sleeping on the couch or you're playing video games or you're just like ignoring, like, you know, we as nurses, we try to involve the partner. Like we do try to help facilitate that. But if I'm trying to do that and you were like not helping, that's really drives me nuts. There's just other little silly things like, I don't know, like you're eating in front of them and they can't eat, like let's say for whatever reason.
I had a dad bring a panini press
I was gonna say, a panini.
into the labor room and start grilling paninis.
Yeah. I've had like dads who are like stripping off their clothes in the room. Like, why do we need to do that right now? Where there's like other people in the room, like just like weird stuff that I'm like, how do y'all exist out in like life? I'm so confused. But the other question you asked was, what was
What's
it?
important?
Oh,
What's important to track? Like
Yes.
Before your postpartum.
okay. So like if you, and this was a big struggle for me, but like you leave the hospital and you're so overwhelmed because your body has been through a huge change, and you have to keep track of your baby and like everything going on with them. So usually when you go for that first pediatrician appointment, it's like 2 days. Typically, it can vary, but like 2 days after you get discharged, and they want to know usually how often the baby eats, which if you breastfeed them is like, I don't know, all the time. And how long? I don't know, just all the time. But pees, poops, and how often they eat, how long they eat. So definitely keeping track of that is important. I usually tell people use an app or whatever's easiest.
I always tell people, like, one of the most important things that you can do to provide yourself with like a positive birth experience is to choose your support people wisely. Having an invested support person who is there to help you and support you have a baby is very different from somebody who is there to watch you have a baby. And this, it doesn't mean that because they made the baby that they get to be there because they made the baby. If you want them there, that's great, but like, if they're not going to be somebody that's there to support you, then they're not doing what they need to do. You know what I mean? So I always say, like, pick them wisely, because it'll make or break your experience. And like, you will quickly learn how annoying it is when somebody is on their phone with the sound on. It's like, boop, 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 tick, 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 and you're like in labor, and you're like, what? Like, hello? So like, pick them wisely, because they'll make or break it for you.
And mothers.
Yeah, mother-in-laws, mothers. Yeah, anybody really. Like, if they're only in the room to be a spectator and watch a baby be born, then like, they're really not helping you. They can wait. Like, they can wait.
How can we help reduce varicose veins during pregnancy?
Compression socks elevate your legs at the end of the day, elevate them throughout the day. But honestly, nice tight compression socks and taking breaks with your feet. It's really, really normal to have swelling those last 4 weeks of pregnancy. It hurts so bad.
Yeah, they do hurt.
But honestly, for the varicose veins and the swelling, especially compression stockings, you can get varicose veins in your crotch.
Yeah.
And there are underwear that have compression underwear.
Yeah.
You can get them, like in your thighs. There's all kinds of stuff out there. And it also helps with the pain, because they can be very painful.
Very painful.
I had one in my groin that was like 4 fingers wide, and it's extremely painful. So you can also get athletic tape if you've got them there, and use athletic tape to safely lift your belly and like relieve the weight of the baby on that vein, because it's just a vein that's getting blocked by pressure somewhere, which is usually the uterus. So like compression socks, you guys like this?
Yeah.
It's great.
We need Galaxy lights.
Yeah.
It's very common
Yeah.
and genetic.
Yeah. You can get them in your labia too.
Yeah.
You know? Did
I
y'all know
I
this?
had that with my third. I thought I was an alien. I was so scared that it was going to be permanent, and the pain was horrendous. So I just want to clarify a little bit about elevating your legs, because how many of you think that sitting in a chair and putting your legs on a stool is elevating your legs, and that equals relief? No. It's like you need to lean your body back, so it needs to be above your heart. So if you can only lay on your couch and prop your feet back up on some cushions, just put a little bit of a tilt behind your back, so you're not laying flat on your back, just a little bit of a tilt. And even it's better to lay on your side with your feet up a little bit to get that. A lot of people think that sitting in a recliner is simple enough and easy enough, and you will not get benefits from that. Next question.
We have one question about what is in the epidural.
What?
Bupivacaine.
Yeah.
It's a numbing agent. So you've got pain medications that are narcotics that act on certain nerves in your body to shut off the sensation of pain. And then you have other things that can treat pain by numbing that area. So if you get IV pain medication, they push it through an IV and it shuts off the pain receptors or minimizes it throughout your whole body. If you have a headache, it'll help your headache a little bit on top of your belly pain. An epidural, it goes into one spot in your back, a nerve that is going to branch out from your abdomen down to your feet. They find that nerve level, they bathe it in a numbing agent, and it numbs that nerve so that you don't feel any sensation except pressure and tightness if it's working well. So it's a numbing agent. Any medication that ends in AIN, like lidocaine, bupivacaine, is a numbing agent.
Yeah. Oh, and we were discussing the other day that it's interesting the differences in epidurals site to site.
Yes.
So
Very
like where I work, we have phenomenal anesthetists who do phenomenal epidurals, and people are moving, flipping, they could probably get up and walk if they wanted to. And then she said, oh, like where I work, like they're like Lieutenant Dan, like they ain't got no legs, Lieutenant Dan. So yeah, so interesting to know that they can be different. But also, and I'll talk about this tomorrow, important to know that you can ask for your epidural to be turned down.
Yes.
A well-functioning epidural should allow you to feel pressure, but not sharp pinching sensations, okay? So if you can't feel anything from like your nipples down, that's too much. Like that's like get it, dial it down a little bit, and that will help you be able to move, to feel pressure when you're contracting, to know when you're going to push, and to be able to push more efficiently. But it's very different site to site.
When I had my first baby, we had it up, my epidural was so high that I couldn't feel any, like there was no, they had to tell me when to push, with kind of hard.
Right?
How do I know if that gets to that point? Do I need to turn it down? Do I need to turn it off? Do I have, where is that kind of?
Repeat after me. Turn it down, right? Like just turn it down.
I want to feel.
Yeah, like, yeah, you like.
Tell them what you just told us.
Yeah.
All right.
The last time I had a baby, this happened.
Yeah.
I don't want that again.
Yeah. Say no, thank
so
you.
if I'm uncomfortable and I'm in pain again, I'll let you know.
Yeah.
We can turn it back up.
Okay.
I don't want what happened last time
Yes.
to happen this time.
Okay.
You can see that in your prenatal appointments. Ask them to put it in your chart. You can see that. Have your partner say that when you get there.
So in each hospital, not only is the technique of doing, or not the technique, but the density of the epidural is different, also the medications are different. There are some hospitals I've worked in where they actually have fentanyl in the epidurals as well. So make sure that you ask what your, what your hospital does as a rule. And then, for like somebody who might be dealing, with chemical dependencies or a history of chemical abuse, they can advocate for bupivacaine only epidural, so they don't have that fentanyl and different doses. So it doesn't have to be a one size fits all. And being able to verbalize, just like you did for us, like this is what I desire. Now, I have in the past run across some anesthesiologists who have issues with that. You're telling me how to do my job, right? So, but the thing is they don't feel what you're feeling. And you can let them know. I know that I risk feeling a lot by you turning this down, but I'm willing to take that risk because of how bad my last experience was. And you will have a button in most places that will give you a little extra bit of the epidural medication so that you are in control of that and how much more you get extra versus just the amount that's coming in continuously. So, but yes, you guys do have choices, and use your voices. It's so awesome.
And let's be real, let's get staff who are going to advocate for you too. So let's say this. Let's say you get an epidural. It's so heavy, you can't move your legs. You don't know what's happening. You're like, I don't know if I'm contracting or not. And you're like, I hate this. Can we turn it down? And they give you attitude or whatever, but eventually they turn it down. And let's say your body metabolizes things really quickly, and suddenly you're like, whoa, this is a lot of pain. Your staff that's with you, your nurse that's with you, should be the one to then advocate and say, hey, anesthesiologist, the epidural is now not strong enough. Could we get in there and could we give her a little top up and up the rate? Like it really should be a dialogue and not just like well, she wanted an epidural and now she has an epidural. You know what I mean? So let's get in the culture of let's discuss it as a team. Let's work together, and that's, I'm doing my job in assessing your pain and figuring out how this is working for you, and now I need you to do your job, and I need you to, get her the pain level that she needs. And it might take some tweaking because everyone metabolizes that medication so different, right? And depending on how much you're moving or what position you're in and where the epidural is, we might have the same epidural and it works like a hot dang for me, and it's not even touching your pain, right? So, and how fast your labor is progressing. So I think we just need to just really move into this team approach where it's it can be touch and go, and maybe you have to come out of your room 2 or 3 times, but can we get you comfortable? And I think we can if we just communicate as a team.
Would you think that you would go ahead and get it and then try to do those tweaks early, or just kind of try to wait as long as possible?
So I would, it's completely, again, up to you. Whatever you want. If you want to get it right away before you feel anything, some people want that. I would personally say it's better to be feeling a little bit just to kind of gauge where you're at. And I always say, I don't know if you guys can agree with this, but in and around like, you know, more of that active phase, because if your area that you're giving birth doesn't allow walking epidurals, because some places do allow that, but majority don't. I would say, you know, the only downside is it locks you in the bed. You can still do lots of movements with an epidural. It doesn't confine you completely. We can move you around.
Yeah.
We have all done it. But it does, you know, prevent you from actually walking around the room. So wait until you're in that active phase of labor where you're contracting every 2 to 3 minutes. You're having to stop and breathe through them, like they are painful. That's active labor. I would say that's kind of the best. Yeah.
Really well, yeah. Here's what I always tell people. If you're planning on getting an epidural and you can use other coping mechanisms, be vertical as long as you can, because movement for you is motion for baby, right? However, I have seen this happen where people are like, I'm going to get an epidural. I don't want it yet because somebody on social media told me not to, or wherever, they read it, or someone told them, so they read it somewhere. Not supposed to get too early. They don't get the epidural, but they don't utilize that time without an epidural to be out of bed vertical. Instead, they lay in the bed and they're like, oh God, this hurts so bad. And they're like just tense from like their hair to their toes. Then that's not really doing you a benefit either, right? At that point in time, sometimes we see that epidurals can actually progress your labor instead of holding back your labor. So if that is the case and you're like, I am tapping out, we are done here, sometimes you can get it, have a nap, reposition in bed, and then your cervix can like relax. So I think it depends too on you. Vertical is, like, in my opinion, the best. Like, it's the best way to change your pelvis. It's the best way to get baby to engage. But on the flip side, like, if you can't get there because of the pain, then like, what is the point of waiting? In my opinion.
Yeah, 100%.
What I would say is, think about if you don't get it right away, why? Why would you not get it? If you think you're gonna get one way or the other, why would you experience that pain? Oh, so that I can move and be mobile. So use that time.
Yes.
Use that why. I don't want it the minute I walk in the door. I'm willing to exchange the experience of pain and wait. But why? To be mobile. So utilize your mobility. We have a lot of evidence that shows us that mobility will lower your risk of a C-section or prolonged labor, prolonged pushing. So if you can do it, like, think about why am I waiting, and like really take advantage of that. If you're noticing, like Tina said, that despite your best efforts, you're just kind of clenching and like that, and it's causing, like, in your brain, like trauma, fear, like preventing you from like ragdoll into the contraction. It's very hard to dilate that way, and that's okay. And then use these tools we have to help you mentally and physically get to the finish line, okay? Nothing magical about the epidural slows labor, but the reason people have that association is because a lot of times with an epidural, people just leave their patients in the bed horizontal and don't move them a lot. So that's why we have that association. So if you're not going to be in your bed with an epidural, like move. If you can't do it, that's totally fine. Then just get some adequate pain medication so that your brain and your body can like get in the game and do the thing, okay?
At what point is it not an option?
Oh, I love
When
this
the
question.
baby is literally
Can I comment on this one too? Because I've seen epidurals put in at 1 centimeter and 10 centimeters.
Me too.
Yeah, fully.
Absolutely.
Yeah.
Many times.
Absolutely.
It's going to depend on the hospital, because it really depends on the hospital. The two big factors where I work is there time for an epidural. So if you come in and you're 10 centimeters, but the baby's not coming out right away, there's time. Where I work, it can take up to 30 minutes from when they ask. It gets placed well, and the medication is working adequately that you get the results you're looking for. That could take 30 minutes. So if you're gonna have a baby less than 30 minutes, you're not gonna get what you're looking for. So that's number one. Number two, however whether you're 10 centimeters, 2 centimeters, are you able to maintain a safe position? Are you able to cope so they can safely put it in? If you're like climbing around in the bed, which is fine, that's not very safe for them to be placing in your back. So you just want to keep those things in mind. I want enough time, like that my baby's not crowning, and I want to know, like, I'm able to cope well enough to hold a position relatively still. And I don't want you to be afraid that they're going to poke you and you're going to be paralyzed. It's not that. It's just for it to work well. The best thing you can do on your side of it appointment what their policy is, because it does vary. But there's nothing magical about a dilation, about when you get your epidural.
Right.
Yeah.
Right.
She had a very traumatic first birth, which was a C-section, and I was wondering if y'all had tips for a natural VBAC, because she really wants to go all natural.
Yes, there are some great recommendations out there. So I'm also a Lamaze certified childbirth educator, and one of the most important things that you could do is be working on coping techniques that you know are going to work for you, and mindfulness, okay? I'm sure everybody has heard of Bridget Taylor, Teyler, on YouTube. She has so many amazing birth meditations, pregnancy meditations, induction meditations, all these different mindfulness things, because really what it comes down to is feeling safe, feeling that you understand what your body is going to, and trying to recognize, like, when you start to go off into kind of like a triggered state, have you been practicing these techniques enough to where you can bring yourself back? And it might even just be the touch of your support person. Okay, we're gonna breathe in, and we're gonna go out. Okay, you are safe here. Sorry. I'm just gonna touch Sarah.
Sarah, you're safe here, Sarah.
You're
You need to
safe.
get her voice back.
You're safe. You're doing it. Like, breathe, and let's open to this birth. This is, this is a beautiful thing. And so the thing is practicing and preparing your mind, in my opinion, is the most important thing. It's great that you guys probably all follow us on TikTok, right? Or all the different platforms, but having a well-structured class, program, membership.
Doula.
And a doula, yes, definitely.
Kara just wants to ask.
Yep.
Yeah.
I've had two unmedicated births and one epidural birth, and I will say, yes, the biggest thing is like preparation. It's all a mental game.
Yes.
Like the patients who are like, or my friends, or just anyone who's like, I'll just wing it.
Oh, dear.
They're like, you're gonna get an epidural.
Sure.
I mean, it can. It's gonna be a lot harder. I think it's like 99% a mental game, and like really being prepared. Like I tell people literally train for it like you're training for a marathon.
Yes.
Like listening to like birth meditations or whatever. I use Bridget
I
Taylor.
love her stuff.
I would go to the gym, and when I was like on the treadmill or like on the elliptical and I was like huffing and it was hard, I would literally practice my breathing exercises. So I got in the mental like preparation for it. And then doula I think is like so important. And if you can afford one, a lot of times you can find ones in training and they will do discounts, or you can or they're sponsored ones. Yeah, so there's a lot of options too for finding extra support people. But like just doing your research on
Prenatal yoga too.
Oh yeah, prenatal yoga.
Yes. Like you can find classes on YouTube for free.
Yeah, but I did a lot of my preparation I did for free, and it was like Bridget Taylor. I downloaded like guided meditations. I listened to them in my headphones like while I was in labor.
The Gentle Birth app is awesome as well.
Right.
But
I have to say too, like, I feel like a lot of it comes to muscle memory. Like, you can think that you're going to be fine, and you can like hold a piece of ice in your hand one time and be like, yeah, like that's fine. But like, when you think about birth and you take yourself out of the calm, regular every single day, and then you put yourself into a birth and you have a hormone shift and a stress response, and it's basically like traumatic to your system, your brain sort of will go off the rails. And I think if you have that muscle memory where like body, like you know what to do, we've done this like, for 8 months now, like we can do this, your body is ready to do this, as opposed to feeling that stress and not knowing where to go, and you're like, it will be a lot harder for you to get back on the correct path towards your goal of what you want to do.
I have one more.
Because us nurses are coming in and out
It's like
too.
muscle memory.
You made me think of this too. A big part of it is also feeling safe. So like tying in, having people there who make you feel safe, no one who's gonna be disturbing your peace, and or telling you what to do. So just feeling like the environment that you're in is safe, and not letting people push you around. So it's important.
I'm so sorry with my whispering. So I had a baby last year, and I had 3 births without an epidural. And prenatal yoga, like breathing exercises. Even though I'm a nurse, my husband and I did labor classes, and that stuff like really was helpful. And I have very supportive people with me, and it was supportive because I went in there thinking, if I need an epidural, you sit there and you're like, it's temporary, it's temporary, it's temporary. Like, this is gonna pop. The minute it's over, it's like it never happened. And you're normal again. So that, for some reason, that phrase really helped. Another really random phrase that always sticks with me that I learned when I was doing prenatal yoga on like a DVD was like, loose, make my body like a rag doll. So I would imagine a rag doll bonds up, like melting. And whether that changes my body and cervix or anything, I don't know, but it entertained my brain and refocused me. And we know that like if you're able to relax your musculature, you can relax the soft tissue in your cervix, help you dilate, an intuitive body movement. If you want to stand and move and do some of this, if you want to make noises, do it. But that's why having a comfortable, like people you're comfortable with, that they can hear you make these noises that you've never made in your life, and you won't feel embarrassed about it. You know, it's all about safe and being empowered and being in charge. So yeah, I mean that's how I felt. And at every point I was like, I'm okay right now, and if this is no longer working, I'll get an epidural or my pain management, which also felt good. It didn't feel like I was unsafe and stuck, and you know, I still felt in charge, which helped me a lot. That's just me.
Did you feel like there was a difference between your healing process after the epidural versus after natural?
I mean, for me, no, but so I feel like I'm backwards of most people. I feel like most people get an epidural like their first baby, and then their subsequent ones, they're like, I'm gonna do this natural. I'm like the opposite. I was like blissfully ignorant. I mean, no, not really. I am super proud of myself for all of them, and all of them were exactly what I wanted. But healing wise, no. Like, it was the minute my epidural with my third, like I was up, moving around, went peed, felt great, no tear, no swelling, felt amazing. But everyone's body is gonna be.
That's a good question.
Yeah,
Did she prefer one to the other?
I mean, the epidural was really nice. I think it really depends on the person. I feel so proud, like I feel so badass for my unmedicated ones, but I do for my epidural too. And I wish I hadn't like almost bullied myself with the first two. I really felt like I was a failure almost if I got it. But then having my third with an epidural, everyone was like so supportive. All my nurses, I was worried people would judge me for getting one with my third. No one did. They were so proud of me, so supportive of what I wanted. And I felt like so safe the whole time. It was great. But healing wise, no, felt amazing with all of them. And like literally, I mean, I think it's important to advocate for your movement, for your epidural. You know, if you want to labor down, I don't know if the research is kind of weird about that. I'm not super.
You can find research to support either way.
Okay, I know it's kind of like hit or miss. I personally labor down, which is where you don't push the minute you're 10 centimeters. You can kind of like wait till you feel more like the urge to push. So I personally did that with all of mine. But yeah, recovery-wise, I felt great, all of them. That's so interesting. Instantly up, moving around.
What does like postpartum look like? Like what your first night postpartum? What is your nurse doing? What does that look like?
Okay, so this is probably going to vary on the hospital a little bit too, but the first like 4 hours are kind of very busy. I mean, they are and they aren't. We definitely want to prioritize the golden hour for you, where usually your nurses are so great about that. They'll sneak in, do your little fundal rub, just make sure everyone's breathing and sneak out and really try to limit interruptions. But the first few hours we're doing a lot of just checking to make sure, because you're at risk for postpartum hemorrhage the most in the first 4 hours after delivery. So that's why we're really checking you. But then after that first night, we will come in, we'll do fundal checks, we'll do lots of education, make sure you guys are safe and comfortable. But we really, at least for me at my hospital, we really try to prioritize you sleeping and getting a break. And I always tell people, do not feel bad about sending your baby to the nursery. I've had patients be like, oh, I feel like I'm gonna get judged for like sending them. I'm like, no, let me take them. You need to sleep, because I want you to be well rested so that you can safely and effectively take care of your baby. And you're not gonna be able to do that if you're just like, you've had no sleep for 3 days. So anyways, we try to prioritize sleep, but we'll be doing fundal checks. We'll be coming to check on you. You know, we go over safety stuff, make sure you doing just tons of, I feel like postpartum is like literally 90% education. We're doing so much, but we'll try to do more of that during the day when you're awake. at night, we're really gonna try to let you sleep.
Yeah. Yeah. No one's talking about.
What do you
car seat
exactly
safety.
mean by sending the baby to the nursery? Is that something that exists in the U.S.?
We don't
that's
have
not
one.
in Canada?
It
Not in
depends-
our place either.
It depends on the hospital, I think, too.
Yeah.
So my hospital, we do have a nursery, and you can send your baby literally if you wanted
That's amazing.
all day long. I mean,
Yeah.
which I have had people do that. But I mean, usually what we do is we'll take them to the nursery. If you want to, you can totally also keep your baby in the room with you 100% of the time. We have patients, I did that with my first. We just had her, what we call it, no separation. So she stayed in the room with me the entire time. And we do that all the time if people want to. But also, if you need the nursery, if you need to get sleep, there's nurses in there 24/7. The baby is not left alone, I promise. And if they cry, yes, if they
We don't either.
Yeah.
You can ask for respite, and the nurse will take we take the baby at the desk and chart.
Oh, yeah. Well, we hope the baby is. Most
Yeah.
nurses will be so happy.
We're
to
sitting
do
there,
that.
yeah, they'll make it work. But yeah, we really,
So you get some sleep.
Yes.
yeah. But I think there's baby-friendly hospitals,
Yeah,
which
that's
are a
right.
thing,
Sounds good.
baby-friendly. And so they like move away from the nursery. They don't necessarily have them, but nurses will offer a lot of the time. If we have time, yes, if we have time, we will hold your baby at the nurse's desk and chart and cuddle them so that you can get some rest. Yeah.
What is the correct muscle group that is used for pushing? I've heard it's like the same.
Transverse abdominis. Yes.
I was like, oh,
Yes,
here,
sir.
here.
I didn't know that. I didn't know what muscle group it was. I just.
So, it sounds crazy, but you use your transverse abdominis muscles, which are, you have up and down ones, and then you have side to side ones in your core, the same ones that you use when you have, like when you poop. And you're gonna push there, you're not pushing in the vagina, even though that's where baby comes from. And that's because when it's time to deliver, if you have a vaginal birth, the baby's really low, and the baby's head is tilted backwards to
Yes.
fit under the pubic bone. It doesn't just come straight. The baby's head's tilted back, presses against your rectum, and then you're gonna use transverse abdominis muscles.
No, baby, let's
No.
Baby's
Yeah,
head
backwards.
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 You're gonna these crunch, literally doing a crunch, and then baby comes, it does something called restituting, tilts its little head and like nose dives out. It's not just a string, it's like a curve under your pubic bone. Yeah, so if you can feel it, it feels pretty intuitive. It feels
Yes.
like a poop. Feels like you're shitting a brick.
She's like a baby.
And it's really important when you're pregnant. A couple things I really like to encourage people to do is be really mindful. What is your core doing when you're laughing?
Too much.
Like, how does that feel when you're coughing, when you're vomiting, and when you go to the bathroom? Because if you think about it, when you go sit on the toilet, yes, I know sometimes in pregnancy we're dealing with severe constipation, but generally speaking, we're not sitting on the toilet to have a bowel movement, bearing down and turning purple, right? It's more about, oh, I have to go, I feel that urge, and going and sitting on the toilet and relaxing all the sphincters. And the same is true for birth. We are relaxing everything to allow our pelvis and everything to open up for the baby. But a lot of times we get super tied up thinking that we have to be so super strong in our core to have the strength to push the baby out. And your uterus is pushing that baby too. So it's a joint thing. It's not a one woman show. It's you and the baby working as a team.
Question. I'm adopting, and I was wondering if y'all had tips for like helping the mother before labor, during labor, and then postpartum.
Now, will you be present
Yes.
during the birth? Okay, so definitely be taking childbirth classes. It should not even be a question for everybody. Getting a good, organized childbirth classes is so important. And then it's also nice when you have access to somebody that's teaching those classes. So even if you don't have the ability to go to in-person class, which would be ideal for everybody, but not everybody can go for 3 hours a night, 6 weeks in a row to live classes, right? So sometimes you could do the virtual ones that have a personal thing. Now, I do them myself all of mine are pre-recorded, but then you have access to me as well. But getting into classes that are well organized where you have that personal contact, and then if you're able to do the classes with the mom, that's great. It might be hard for them, so you kind of gotta, this is one of those things depending on how your adoption is going. And then asking them in what capacity they want you there. Are you going there to be their support person or to observe? And in what way can you be present that would bring them the feeling of safety and comfort and calm, okay? But I do want to let you know, as an adoptive mom, there are some moms that induce breastfeeding, so they induce breast milk, and that's great. But even if that's not something you're doing, skin to skin is very important for you and the baby after the baby has been delivered, okay? And usually we have a room for the adoptive mom and the baby, and the adoptive father, if there's a father or another parent, and then a room for the birthing parent. So and of course it varies from hospital to hospital. So.
You can do skin to skin, not just that golden hour.
No,
you can do it weeks. I've done skin to skin with like my 3-month-old when she was sick. And it sounds weird, but it's not weird. You get in a bathtub with your baby if they're sick, or just do some skin to skin. Like and it's relaxing for both of you. So it doesn't just have to be that first hour. It can be a wait upon.
Yes.
Something I said is like, when I had my first baby, I gave birth to her, and I didn't have an epidural, and I looked around, and it felt like I was a nurse at any other delivery. I didn't connect right away, and it was fine. But then, I was like, God, there was so much. I was just like, oh my gosh, something crazy just happened to my body. And then I turned around and sat, and they brought her to me. And never in your life is there a naked baby on your naked chest, and like covered with blankets. And it's something about that was like, this is my baby, it's mine, and it changes. So that skin to skin can be powerful when it doesn't even have to happen right away. When you're ready, it can be powerful.
That was really nice.
I was in there in the room with her.
I'm like,
I can feel it.
oh, right.
For postpartum, I just feel my niece and nephew were adopted too, and I've been very involved with their whole life. But definitely just being there for the mom too, I think, because some people, and I don't think you would do this at all, but some people are like, bye to the birth mom, and just still being there because you want to have a good relationship with her too. That means a lot. But we take care of adoptive parents all the time, and it's a beautiful, amazing experience. Don't feel like it takes away anything because you didn't personally give birth. It's still an amazing experience, and we're still gonna treat you just like if you gave birth to that baby, and gonna educate you, and it's gonna be amazing.
And don't sell yourself short. Give yourself permission to do all of the things that you would still do if you were carrying. This is your baby, right? Have a baby shower. Get yourself a labor gown. Just lay it out. Skin to skin. Do all of the things. This is don't give yourself permission to do all of the things because this is your baby, right? Right. Okay.
Obviously, babies come when they're good and ready. But what are the things that are actually helpful? Not just oh hey, this person on Pinterest was like, hey, do this. Blah blah blah.
That's such a good question.
Naturally.
We have good evidence on all that stuff. Does anybody else want to?
You want to know about natural labor induction sort of thing? Is that what you're thinking? Yeah. I literally just did. Kate, you have to keep in mind that any natural labor and induction methods, they're supported by anecdotal evidence. There isn't really anything that's going to make you go into labor except your baby and your body, right? Yeah. Are there things that could maybe nudge it along? Absolutely. Are there things that are a novel idea that have no risk and you could do them if you want? Absolutely. You could eat 1,000,000 pineapples if you love pineapple, right? Maybe it'll help you, or maybe you ate a pineapple and your body decided to go into labor, and so you said, I ate pineapple and I went into labor. I would think something that's 50-50 as a membrane sweep that you can get done by your provider if you're into it. But again, 50-50, or it could be coincidental. So I don't think that there's anything that is guaranteed you're going to have a baby except a medical induction by your doctor. And I don't know.
I can tell you straight up myths that we know so far, right? If that's helpful.
Pineapple.
So pineapple, contractions. So far that's a myth. Maybe that'll change. So if you like pineapple, go for it. But we haven't seen it. Also, people have eaten pineapple in early late pregnancy, and it doesn't cause preterm delivery or anything. So we haven't seen that be a yes. But if it doesn't hurt anything. Sex is another common one. The concept of it is can cause contractions. The prostaglandins, if you have a male partner, the prostaglandins could potentially ripen a cervix. But we don't have any evidence yet. We have surveys that it's been helpful for people. There's no real studies yet. So again, if you're in a place you're at the end of your pregnancy, you do not want to have sex, do not do it.
Yeah, don't force yourself.
But if you're like, I'm feeling it, and maybe I'll go into labor, go for it, right? Other things, raspberry leaf tea, nothing solid, but it is an herb, right? So keep that in mind. Or not an herb, nipple stimulation does have some good evidence behind it, but it's something you'd have to be doing for like a couple weeks, several times a day. And expression, again, several weeks, couple times a day, and you need to run all this by your provider, because there's other factors that could cause problems for your pregnancies. You gotta check with them. Eating dates, there's some good evidence there, even if you have gestational diabetes. But again, it's a commitment. You'd have to eat 6 to 7 dates a day.
Look at Caitlin's like,
for 4 weeks, and it may shorten your labor. It may help you be a little more dilated when the time comes.
Right.
So at this time, there's nothing that will push you into labor. There are a few things that may help make your labor a little better. It may put the odds in your favor. That's what it may do.
Can I add something to that? So in my experience with people that I've worked with in the hospital and as a doula and in home birth even, one of the most important things when it comes to induction of any way, it could be natural induction, it could be a membrane sweep, it could be inductions in the hospital, is your mind. So we have to do everything we can to decrease our stress hormones. Oftentimes we see people, oh my gosh, I gotta get into labor. How many days should I eat? Can I go get a membrane sweep? Like you start to just get all worked up. How many of you have felt worked up in your pregnancy? Anybody? Yeah, I mean, we do it, right? Our brains we get so stressed. And so doing what you can to be at peace with where you are in this moment in time, so you can decrease those stress hormones, that adrenaline, the catecholamines, all those things is vital in order for your body to do what it needs to do and release those natural oxytocin and for it to receive them. Because if those receptor sites are so full of all those other hormones, it doesn't matter if you just had sex, those hormones can't go anywhere. And so doing what you can first to decrease your stress, go for walks, spend time with people you love, sit and look through a photo album, watch a funny movie, dance in the kitchen with your partner, do things that are going to decrease your stress and increase your oxytocin is really important, because a lot of people get so stressed, and we see people come in for inductions and they're so stressed that sometimes those inductions can take days. Now, I am not saying that if you have an induction that takes days, it's because you're stressed and it's your fault. That is not what I'm saying at all, okay? But what I'm saying is, in order for any type of induction, natural or medical or elective, getting those stress hormones low is super vital, okay? Yes.
This is what I say. Okay, this is what I say. What you can do to help your body labor, rest. If you're not resting, you should be moving your body, fueling your body with good nutrition, and hydrating. But it's all about a balance, because some people, mind you, only 5% of babies come on their due dates. So and the due date's an estimate. So there's a lot of factors at play. But yeah, I think people get so caught well, I'm 39 and 5 days. Why I should be having this baby? Why haven't I had this baby? What can I do to make this baby come? And they're so pent up.
They feel
so then they walk miles and miles and miles, and they're up and down curbs, and then you've exhausted your body. Then when you finally go into labor, you're exhausted, right? And you can't fully. So yeah, I always say if you want to do the things that are risk-free, rest, and then do some things. Yeah. But I agree. Yeah.
When you guys are born in the NICU, how do you, as a parent, kind of prioritize bonding with them and spending time with them and stuff like that?
Oh yeah, that's a great question. I think one important thing is just making sure that your nurses know that you are the parent, because some nurses can be a little possessive of babies and it's their baby, but you are the parent. We can still do breastfeeding at the bedside. We'll put dividers up around you so you have privacy. If some NICUs have their own private room. At mine, it's like you're in a pod with other families kind of around you or other babies. But we'll put up dividers. You can do skin to skin. You can breastfeed. You can be there 24/7 if you wanted to be. I don't know of any NICU that is like, no, you have to leave at like.
Can help with care. Do you guys call them cares?
Yes. Oh yeah. Great question. Yeah. Great
Take
point.
like a baby at home for an animal to smell. For
Right.
to smell when she bumps.
Yes, you can. I'll say that again because your voice.
Yeah.
You can like bring. You can leave these little like cloths or like clothing that you've got your breast milk on there with the baby, so they kind of smell you when you're away from them, or to take it home. But then there's care times too. So we do like that's what we call the time where we like change their diaper, we feed them, we snuggle them, whatever. And the parent can totally do that. I mean, like you can change the baby's diaper and you can feed them. Yeah, take their temperature. So just advocate for yourself. Are you planning on? Is your
No,
you think?
no,
or
but
just
I just know some people who have, and
Yeah.
I just thought, it must be really hard to
Yes.
go home
It
and your
can-
baby's not going.
It can be a really traumatic experience, and I don't think people talk about that enough. It's like, not always, but it can be really traumatizing. And so just don't feel like, oh, okay, like they're in charge of my baby and I need to like not get involved or whatever. Like, no, you're still their parent. You know them the best of anyone. So if you notice a change in the way they're eating or something doesn't seem right to you, you can tell the provider, the nurses. Like, I had a parent do that like last week. They were like, I don't think they're taking this, like, there was like this weird attachment we were using on the baby bottle, and they were like, why don't we try not using that, because I feel like they did better without it, and we changed and the baby did great. But like the doctor had been like the one who was like, we should use that. And but it ended up being that the parent did kind of know what was best for that baby.
Yeah.
Baby is half you.
Yeah.
It's half you.
Yeah.
You know?
Yeah.
You know the baby.
Yeah.
But I think being there for those feeding times and the care times that's designated, that's huge. If your schedule can allow it, like that's the main thing I think that would be beneficial.
And call as much as you want. Like, don't feel like you're bothering us. Like, I know some nurses are like, oh my gosh, this mom's like calling after every care time. I don't care. Like, you should.
Yeah.
And like, if a nurse thinks that, like, they're
the problem.
They're the
Yeah.
problem, not
Yes.
you.
You guys have the angel eye.
Yeah, we have the angel eye cameras too on the baby. So
Oh.
like, you can watch your baby on a little monitor 24/7.
24/7.
That's so cute. It's
Yeah.
like a little like
I
doggy
love
cam.
Yeah.
Sorry, I don't have kids yet, so that's what I think of.
It doesn't a very cute dog though.
I know this is something that we hear a lot. It's about eating during labor.
Oh.
I know, Tina's so excited. She asked, should I eat if I'm low risk during labor and I'm worried about emesis, which is throwing up, because of a possible emergency C-section? She was told, you know, in case you have a C-section.
Yes, she would have been told that. Yeah.
Oh.
Since
And this is
1941,
just
we've been
one
told.
of
Shut the
those-
phones down. Yeah.
Yeah, shut the phones up. No, don't leave them on. Leave them on. So this is one of the
First
ones
rule
that-
about no eating and drinking club is you don't talk about no eating and drinking club.
What I don't see,
Yeah.
it doesn't matter, it didn't happen.
Yeah.
So, unfortunately, in a lot of hospitals, this is the case, but not in all hospitals. So I worked in 5 hospitals in 4 different states, and, in some of those hospitals, eating and drinking labor was not a big deal. Now, once you got an epidural, they generally wanted you to go to clear liquids, but in the hospital that I was at that was like that, they were like, oh yeah, gummy bears count as clear
lollipops.
liquids, lots of
Yeah.
lollipops,
Popsicles.
popsicles.
Jello. Yeah.
And we even had the protein drinks that were clear.
Oh, wow.
So, those are total options for you. Now, not every hospital's gonna have those, but if you are thinking you might end up being on a clear liquid diet, those are things you might wanna consider packing. But in practice, in my experience, if you feel like eating, if you're low risk and you feel hunger, we really want you to be, trusting what your body's telling. Now, I did a poll recently. I love doing polls because I want to know what people are thinking and wanting. And really only about 40% of the people even wanted to eat in labor. A lot of people, they don't even think about it because it's not on their radar. They are, especially in active labor. It's usually those that are having an induction or that are in prodromal labor that really need that fuel. And so, and not giving you that fuel can be hard. Now, there are hospitals that will say it is against hospital policy for you to be eating and drinking in labor.
Hospital policy.
So, Number one, I would encourage you to ask your nurse to show you the policy. Because you know how many hospital policies I've seen that say no eating and drinking in labor? 0 in 5 hospitals in 4 different states. It's not. It is a preference from some providers, some anesthesia, some OB, and some nurses, because what you eat in labor may come back up. Okay? So, yeah, remember the BRAIN acronym.
Don't just say
what
no.
are the benefits?
There's ways to be the boss, to be in charge of your care.
Yes.
And sometimes we think that means saying no to everything.
Right.
That's not necessarily true. Really being the boss, really being an advocate for yourself is using BRAIN, learning all the options, considering them all, and then deciding what feels right for you.
Yes.
So maybe, that doesn't necessarily, so if you're in active labor and you're not even hungry, but you're like, I don't want them to tell me what to do, and you eat chicken fingers, and you don't want it.
Cheeseburger and then you go with it.
Listen to your body, yeah. So it's just use the brain, go through, like you said before. Just, keep in mind that being the boss, being an advocate doesn't always mean a no. It just means I decide when and where we say no and yes. That's an advocate for yourself.
And doing that while you're honoring your own body, okay? Because I don't know how y'all are, but sometimes if somebody says no, I'm gonna do it just because they said no, even if I don't want to do it. So really honor your body and what you're feeling and what does it need right now. It's so vitally important, and this is one of those hills I will die on. You get to choose. No risk-free options. Yes, you could aspirate. Do you know how your risk of aspirating? It's so minute. Like it is so tiny. But we see people have cesareans or vacuum assists or forceps for maternal exhaustion because they're not eating for 3 days. It's not okay. So there's no risk-free choice. Trust your intuition. Honor your body.
And also keep in mind that it's back to our marathon point that Kara mentioned earlier. I always tell my patients, labor is a marathon. You're not going to eat a massive foot-long sub and then go run a marathon. You're not going to do that, right? What's going to happen? It's going to come back up. Small, frequent meals that feel good for you, go for it. There's nothing wrong with that. There's nothing wrong with that.
Right.
I highly encourage you to, okay, I have a video on this on YouTube. Mama Dr. Jones has an incredible video. The guidelines on eating and drinking were made in the 1940s, okay? I don't know where we are today, certainly not then, by a gentleman named Dr. Mendelsohn. So if you have a chance to look up Dr. Mendelsohn's study that he did in the 1940s, you will figure out where this came from. And we have to look at, again, you have to look at your absolute risk of having not just a C-section, because we know that C-section rates are high. You have to look at the risk of having a C-section that goes into a general anesthetic. That's where the risk of obstetrical aspiration, or of death by obstetrical aspiration comes from. It's not just a C-section. The risk is if you have a C-section and it is so urgent that you need to be put out immediately because your baby is in dire straits or you are in dire straits, and there's not time for a spinal to work, right? And a lot of times, and then you have to be put out, and then you also have to vomit. And so when we think, so I could go on about this, I'll keep it short. These deaths that were occurring in the 1940s came from these patients who were put under general anesthetic, and they were intubated, and their airways were not protected. So we have to think about how our techniques and advances in science and technology have come along in the past, 70 years. And now these people are, if you're put to sleep for a general anesthetic, it's generally a very safe thing, and your airway is protected using technology and equipment that is specific for putting people to sleep, right? So I encourage you, if eating and drinking is important to you, some people don't care. Some people are like, I don't care to eat and drink. But if you think it is important to you, really do a deep dive into where those guidelines came from, what the risk for you specifically is that this could occur. It's very low. I believe it's like 0.045% or maybe even less. It's very low. And then sort of factor that in and discuss it with your provider early. Say to you, it is important for me to be able to snack. And I also say, don't eat anything that you aren't afraid to see come back up. Because in the competition between your uterus and your stomach, in active labor, your uterus will win 100% of the time. And if there's food in the way, it's going to come up. So keep that in mind. Eat how you feel if it's important to you, and just let them know, like, I'm aware of the risks, but eating is important to me, so at this time, I'm going to decline that, and I'm going to have a snack.
Something I would keep in mind too, and again, I'm not saying this is like right and evidence-based or anything, but if you are like having a scheduled C-section, or if we're looking at the C-section on the horizon, like you're in labor and they're like, oh, we might have a C-section, it's plan C, but like, then there are places that will postpone your C-section. If you have eaten, they may postpone it 8 hours. So keep that in mind. I'm not saying don't eat or anything, I'm just saying, again, we're going back to the brain, right? And knowing your risks, your benefits, your alternatives, making good decisions for yourself. So if you're like, okay, if this becomes like, again, this is a non-emergency section, right?
Yep.
If it's a non-emergency section, they may postpone it if you ate recently. So if you're okay with that, just know that, okay?
Yeah,
That's a
I have a
very
big
good
YouTube.
point.
Go on, I have a big YouTube video, but like I have, yeah.
But let me just add to
Yeah,
one
well,
more thing.
we're all like eating and drinking.
But if it's an emergency C-section, like there's an emergency, baby needs to come out, they're gonna do it anyway, even if you ate 5 minutes ago.
cheeseburger and
So please know that.
And they're like,
Take-
get out.
Yeah, so don't worry that, oh my gosh, my baby's heart rate might be down and we can't do a surgery because I just ate.
Yeah, it's
Okay.
non-urgent.
Non-urgent, yeah.
They may say, okay,
Mhm.
you and baby are fine, but we do need a C-section.
Yeah.
We're gonna
We-
be in 6 hours.
Yeah.
It's possible.
Yeah,
Again, I'm not saying I'm a fan,
right.
but just like, just when you make those decisions to eat or not, all that stuff, you know.
We had a mom who was a repeat C-section, but her bag of water broke. And so her bag of water's broke. She knew she was gonna have a C-section. She ate in and out on the way to the hospital.
my God.
And so she got there and anesthesia's like, no, we're not gonna do the surgery now. I mean, she just ate in and out and a shake. So we're gonna hold off on that, you know? So she was kind of stunned about that. But, you know, so, but to her, that was very important. And she didn't mind waiting because she knew that she was gonna be going a distance of time without eating after, right?
Also, that being said, like if you're having a scheduled C-section, please abide by the
Yes.
the thing.
Yes.
We are strictly talking about people in labor that might end up in a C-section, that might end up in a general anesthetic. So if you are given instructions, don't roll and be like, well, the nurses are like, you eat in and out and come on in for your, don't do that.
No,
If
don't.
you're having a
Because
scheduled section.
benefits and risks, right?
We don't know your history.
Yeah,
Right.
yeah.
So even though we are nurses, we are not your nurses, and we are not giving you, we're not giving you medical advice, we're giving you education.
Like a
right
scheduled
now.
section is like a 100% chance of a C-section, whereas labor is not
It's
a
not.
100% chance.
Which
of
is
it.
why it's so true.
Same as any surgery, like they're gonna tell you not to eat or drink because they can. It's scheduled, it's
Exactly.
controlled. It's
Exactly, so
Anyway,
it's
so
quite different.
don't roll in there. full.
Yes, back here.
This is my first,
Okay,
natural or
right.
epidural?
Yeah.
Right, so,
That's what-
and that's what everybody believes, right? That natural or epidural and nothing in between. So it varies from one hospital to the next, or like some hospitals, most hospitals that I've worked in, you have the option of IV medication. You can use hydrotherapy, so whether it's the shower or the labor tub, if your hospital has those things. And then some hospitals have nitrous. I've never worked in a hospital that has nitrous. So you just never know what, the laughing gas, right? So you just never know what your hospital carries or allows. And so you definitely want to check. You can talk with your provider. They should be aware of the hospital that they're at, what you're allowed to do in those different places. I don't know if anybody.
I agree, yeah.
I mean, those are the most common IV narcotics.
Yeah.
So the conversation, IM, if you don't have an IV in place, you can IM, which means a shot, which we don't do that very much.
We do, I do that a lot.
Oh, I never,
In active labor?
never.
No, early.
Yeah,
early,
yeah,
like
yeah.
early
Oh,
epidural.
we don't do that much here, but it's an option, you know?
Like you're not admitted yet.
Yeah. So I mean, even Tylenol, that sounds ridiculous, but
It is helpful.
it can be helpful in early labor,
Yeah.
Nitrous oxide, laughing gas, epidurals, varying levels of epidural coverage.
Dental block.
Few dental.
Blue dental bugs, that one I only seen like twice.
Provider different,
Yeah, but
More rare.
a TENS unit, you know, comfort measures, other things.
Combs.
Yeah, labor covers.
Combs are awesome.
Acupressure, sterile water injections in the back.
Yeah, we don't do those.
No?
have you guys ever heard of evidence-based birth?
Yes.
Yeah, I'm telling you, go to evidence-based birth. They have a podcast, which is phenomenal. And they have articles. If you don't want to listen to the podcast, you can just scroll all the way to the bottom and look. And what they do is they find this girl's doing all the hard work for us.
She's amazing.
She's a researcher, she's a nurse with her doctorate. She finds every research article ever. She pulls them together on whatever it is, whatever you want to know. Then she tells you what that means. And she says, do what you want with it.
Yeah.
And so, like, I mean, right down to aromatherapy, right down to, like, massage, acupuncture, everything. It's amazing. So I would go to that website or listen to podcasts. They're like 20 minutes long. You can listen to it on a walk, you know.
She said, hi, my water just broke. She says, what do I do while at home to get contractions going? She said she already called the hospital.
Yeah.
Wonderful.
Yeah, so.
Also, Tina is a lovely name for a baby. Just you know what I suggest? Make a note of the color of the fluid and how your baby is moving, first of all, and then call your provider. If the color is anything but clear, proceed directly to the hospital, please. But yeah, like call your provider, and because some people are different, right? Some providers are like, I want to see you, and then maybe you could go home. Some providers are like, you need to now be induced. Some providers are like, you don't have to come in. Let me know how you feel. You know what I mean? So I mean, it's going to be different.
I think they told her to stay home.
Forever. Did they say stay home?
Right. Yeah, they do.
Oh, there you go.
I know how to get her contractions.
Oh, okay, yeah. Oh,
Yeah.
yeah. Movement for you is motion for baby.
Miles per kid.
So, and it depends.
Yeah.
Where are you in the world?
Yeah.
And what have you been doing? Have you just worked all day? Or
Are you
did you
exhausted?
go shopping at the mall all day and you're utterly exhausted? So have a nice little meal, something small, and lay down on your left side and just get super comfy and rest a little bit, and then you can sit on the ball.
Toilet.
There's no right or wrong,
Sit on the
but
toilet.
yeah, sit on the ball. And we're not just, I wish we had a
Yeah,
birth
right.
ball right here. We're not just bouncing on the ball, that's good if you want to do that, but you want to have wide legs, you want to do like some figure eights, you want to do some hulas, you want to move your hips, things like the mile circuit depending on your situation.
On the ball, knees lower than your hips.
Yes.
To open the pelvic inlet so baby engages better.
Right, but the movement is really helpful, and being in an upright position, going for a walk. You could maybe do a little bit of curb walking. Spinning babies is my favorite. They have a whole, a whole routine that you can do in there. But the thing is you have to check in, right? We got to check in with our body. We got to check in with our mind. How am I feeling? Am I feeling safe? Am I feeling comfortable and confident in my body? If I'm not, let me do some mindfulness stuff. Let me get into a place where I feel like, okay, I can do this. And then check in with your body. So check in with your mind first, in my opinion. Check in with your body. What am I feeling? Do I feel the urge to get on my hands and knees and drape over that ball and do some of this? Do I need to be a little bit distracted right now because I tend to overthink everything and I get myself in a tizzy? So check in with your mind, check in with your body, and do that thing.
It's back to the induction, thoughts on a Foley bowl.
Oh.
It varies.
Yeah. I think it also depends, for me, it depends on what your cervix is doing. I've seen Foleys go in like a beautiful insertion. The person was like, oh, is that all? And then they come back in when it falls out. But then some people, it's like their cervix is like, what is Jen Hamilton's, thicker than a Snicker. And it's like this horrifically like painful insertion because there's lots of manipulation and yeah.
What I've seen is if the cervix isn't very soft or thin, and we force it, even if it gets 3, 4, 5 centimeters slided, it comes out. Where at work we call it a Foley board, where it just stays and stays and stays at 4, 4. You really need some soft thinness, and then I see them work really well. So if it's not very thin and soft, and my provider wants to try my patient, I'm not a fan. I like something to soften the cervix.
First.
Then again,
So external first.
and if you've had a C-section, you cannot have those things.
Right.
But it really is dependent. Or if you're having a lot of contractions, you cannot have them. So it depends. But if it's an option, I like that.
Yeah.
You can even do it together.
Yeah, I was also going to say, like, it probably depends, too, on what you would like. Like, you have to think about it. It's a physical dilation of your cervix, right? As opposed to a medical dilation of your cervix sort of thing. So yeah, where I work, we call them Foxies. It's a Foley oxy combo, depending on what your cervix is feeling. Yeah, which seems to be actually quite successful. It sort of brings baby down, and so I mean, yeah, I think it's like super provider dependent, and again, what they're comfortable with. If they have inserted one Foley ever, and you're their second, I might not love that option. If they do them all the time and they're really comfortable and it's a smooth insertion and you're a little dilated and you're a little soft and you don't want a medication, then it's a lovely option. But yeah, I think just knowing what options are out there, yeah.
So I'm a support person, so aside from taking care of mama, what's a good kind of like route of advice that you guys give?
Take a childbirth class.
Yes.
Even you.
Yes, absolutely. So if you want to be a good support person, a childbirth class is not an option. Like, you have to get that information. We do not expect you to memorize it. I am so sorry, I just like jump in here. We do not expect you to memorize everything.
But being familiar.
Yeah.
Exactly. Because you know what is like, I think helpful is not adding things to do to the person that's giving birth, right? Yeah. So if they're like, can you do counter pressure? And you're like, I don't know how to do counter pressure. And then they like mid-contraction, they're trying to tell you how to do counter pressure. Like, it's just so much smoother for them if you're sort of in the know. Like, it's familiar, like, oh yeah, I remember we learned about that. Like, let's try it and let's do it. And then you're gonna be more confident to do it as well, right? And not be so like skittish, like,
And scared.
I don't know how to do it, right?
You're scared because it's going to be unfamiliar to you. You haven't seen that person, that friend, that loved one, whoever it is, in that situation before. You don't know what's normal.
And you feel
and
helpless.
to have that education ahead of time will help you be like, oh, I remember they told me this, so that makes more sense. Like, okay, this is what I think I should do, you know, and then you can be there for them too. Like, don't ask a lot of questions, but you know, but you could just, anything that they request, you're there for them, and you have tools in your toolbox that you can pull out as well.
And you can like help them. So I feel like it's just really important to know what the phases of labor are, what they look like, how you can help your person during those phases. And also, I don't know what hospital you're going to be at or whatever, but my hospital has free birth classes. So it's good to look at the hospital's website and see if they have them and if they're free. So
I'm just being told, we were supposed to have wrap. We just yap and yap and yap and yap. We're supposed to be wrapped. We can, you guys.
Let's do one more question.
What do you want? How do
if you're planning on breastfeeding, how soon after giving birth should you be trying to latch the baby?
As soon as you and baby are ready. But here's the thing, like, I think there's a lot of pressure on, like, get them on the breast within an hour, which there's evidence to say that getting them on the breast, like stimulating your breast within that first hour, is going to help your milk to transition 100%. However, there's a ton of pressure on people to like get that, like I am at 59 minutes, this baby needs to latch immediately, right? But if you're not ready and your baby is not ready, then that is just like stress on the pile. So I always say, like, as soon as you are both ready, sooner is better. But I mean, they're like, in the grand scheme of things, it's gonna be as soon as you are ready, you know what I mean? And the more you can have that baby on your skin to skin, it's going to encourage that to happen sooner than later.
Google the magical hour, and Anne-Marie Winstrom did a lot of studies on this, and you can see the 9 instinctive stages that a newborn goes through after delivery. And if you are able to have immediate, uninterrupted, continuous skin to skin for that first hour or until the completion of the first breastfeeding, it's amazing. Your baby will likely, if the nurses and you just let them be, they instinctively will latch themselves. And if you learn on the magical hour, you can see those stages and you can recognize them after the baby's delivered. It is so beautiful. Parents love it when I'm telling them, okay, now the baby's gonna start doing this. And then they're like, how do you know that? I'm like, I didn't learn, I mean, I had to learn it, but I'm just telling you what somebody else figured out. It is so incredible. So try not to feel the pressure. If for some reason you and the baby get separated and you don't have a little spoon or a cup or something to hand express into, that's okay. Just hand express into the blanket or the gown or whatever, just to stimulate releasing some of that colostrum to help protect your milk supply. That's totally okay. You could even hand express some as the baby is trying to do the breast crawl, and they'll start lapping it up. But it smells like it does smell like amniotic fluid. Yeah, and your body knows how to make milk by 2 means. The first one is the stretching and the pulling of the nipple as the baby is on the breast and that nipple is getting stretched, and then the removal of that colostrum. So that's why it's so important. If you happen to be separated and your nurse hasn't brought you a pump or something, like say baby had to go to the NICU, just hand express it into, into the cup or the gown or the blanket, on yourself. You could even rub it on yourself. Milk is so good for us. It's amazing. So
is
and the vernix, that, don't wipe it off. Just rub it into your skin. It's so awesome.
It is. It's
amazing. It is so incredible. We so appreciate all of you who got to come live, all your questions. We so appreciate you all. I think we should tell our handles because I don't know that everybody follows all of us. Again, Nurse Dawn, Pivotal Birth. Oh, this is
Labor Junkie RN.
Labor Junkie RN.
Yep, I'm Mama Nurse Tina.
I am nurse_skidney.
Skinny.
And
Nurse Skidney.
Sydney, SYDNEY, like Sydney, Australia, on all platforms. If you give me a follow on all of them, that'd be fantastic. And then Kara.
I'm just Kara the baby nurse on all the places.
Yeah! Awesome. Thank you all so much for joining us.